Hi, my name is Dr. Justin Fleming. I am a foot and ankle surgeon at University Orthopedic Associates. It is my privilege and my pleasure to have the opportunity to just spend some time with Dr. Marc Simon. And Dr. Simon had surgery on December 18th of 2019. Marc, I can't believe it's been almost 2 years since your surgery, but we're grateful for your time today. And we just really want to hear about your experience with ankle replacement, with UOA, and with the care that we provided. So welcome.
Thank you.
So, Marc, tell me what life was like before you had your ankle replacement. I see patients that have, their primary complaint is pain and dysfunction. Just give us some insight to what you were experiencing.
Okay, very quickly, I'm a very active person, very sports oriented, and I started to probably 5-7 years before I contacted you, started to have discomfort in my left ankle. It got progressively worse, eliminating all of my sporting activities to the point when I saw you, I could barely walk without a pronounced limp. I had seen other specialists and all of the local specialists, and they all basically said I am beyond repair, and all they can do for me is fuse my ankle and have a permanent limp. No pain, but a permanent limp, and I was not satisfied with that answer. I went, and they said the only thing you could do is go to New York or Philadelphia to the top institutions. I made an appointment. I went to Philadelphia to Jefferson. I saw the top foot and ankle surgeon. Very nice. Told me I'm at borderline of where he could help me and where he cannot help me. And he told me he outlined the procedures he was going to do. I was in the process of retiring. I'm a dentist. I was selling my practice, retiring. And in that meantime, before I had the surgery, I was made aware that University Orthopedic Associates recruited a highly trained foot and ankle surgeon out of Philadelphia to handle these kind of complex cases because nobody else was handling these in our area. You had to go to New York or Philadelphia. I went in and met Dr. Fleming, instantly impressed, very confident doctor, and being a doctor myself, I could see exactly what's necessary. And talking to him, he had all the exceptional knowledge, training, experience, compassion as I got to know him, and above all, surgical skill. I asked him what he needed to do, and he told me exact procedures. I opened my wallet, took out a piece of paper, which the doctor in Philadelphia had told me he was going to do, and this was the top Philadelphia doctor, and Dr. Fleming's was the exact same procedures, same necessary work, because it was complicated. I said, let's start. When can we do it? From there, we went through all the prerequisites and had the surgery done. My life was miserable before Dr. Fleming replaced my ankle and did all the collateral damage, ligaments, and everything else, to the point of now, I don't even remember which ankle was the bad ankle. And this was after almost every person in our area told me they cannot fix it, it has to be fused. And it was not fused, it was replaced, it was fixed, and I'm eternally grateful. That's my story.
Well, Marc, I love your story, and I'm happy. We're happy when our patients are happy. So this is great. Tell us. I see a lot of patients that come in and they've had some treatments beforehand. Can you share with me all the things that you tried to do to not have surgery?
I basically tried whatever the foot and ankle doctors I had been seeing were telling me to do. I had cortisone injections, which at first were fairly okay, and then progressively did absolutely nothing. I wore an elastic brace. Then I wore elastic brace with metal sides, and everything was basically to keep the ankle in line because it was arthritic, it was bone on bone, and it was absolutely impossible to walk even with it. 20 steps and I was done. I mean, I look back now and I say, oh my God, look at what I'm doing. And I couldn't even walk out of my house before. So that's what my life was before. I was lucky to be in a profession where I was in my office and I would see as treating my patients, so I didn't have to walk around a lot of different places, and my pressure was off. If I didn't have that type of profession, I wouldn't have even been able to work.
Yeah, thank you. And so you mentioned fusion before, and I think I already know your answer, but there's a lot of people now that are, juggling in between whether I'm going to have a fusion or a replacement. Can you just give your experience on kind of how did you know ankle replacement was right for you?
I actually didn't, but I'm in the field, so I did enough reading and talked to enough people, and they said that if it is possible to even try to have the replacement, there's no comparison. A fusion, again, would fuse my foot where I would have a permanent limp the rest of my life. And to me, even though I'm 70 years old, I'm very active, and it's not an option. It's not an option. So I sought out somebody that would try to help me in a replacement. And again, nobody was in our area until Dr. Fleming was recruited. Again, I heard highly trained, recruited doctor to help with this locally. I was thrilled.
Yeah, well, great, Mark. We're thrilled too. I wanted to walk you through just a couple of things. I want to show you what your x-rays looked like before. I took some pictures of you in the office,
Right.
and I also showed you the process on why the device that we use, or at least why I think it's the best. So Mark, I'm sure you remember this, and maybe it pains your ankle now just to see these, but this was your ankle on the left side. And I think the things to point out are, that the ankle is crooked, right? So the ankle is pointed towards the inside. And you can see here that Mark really had a fair amount of ligament damage, and the ligaments that hold these two bones together have kind of given way, and then the ankle tilts. And when you stand from behind, you can see that the left ankle is tilted, and you can experience just how difficult that was for Mark to walk, whether it was giving out on him or painful. And so this is kind of what we started with. I walked Mark through the process of ankle replacement, and the company that we use is called Bright Medical. And the reason that I like this so much is that we can do the surgery virtually. And so on the left-hand side, that is a 3D rendering of Mark's ankle. So this is from the CAT scan. And so what this shows me is simply that that the ankle is tilted. You can see that it matches the X-ray. And this is just part of the surgical planning that goes into really virtual surgery before we get to the operating room to know the pitfalls or to troubleshoot any issues that may arise. And so this is what's called the surgeon alignment review. And so the process is Mark gets a CAT scan, that CAT scan goes to the company. There's a team of engineers that does the surgery virtually, and they produce this report. And this report allows us to be very accurate with the placement of the implant, which we think is important to the longevity or how long it lasts. It's important to get the appropriate size and also to understand the quality of the bone that's around it. And so this is Mark's actual report, and this shows with the ankle corrected in its position in the implant in. And one of the great things that comes out of doing the surgery virtually are these patient-specific blocks. And so you'll see them mounted in gray, and these are exactly specific replications of Mark's bone. And again, so these are used at the time of surgery, and the sole purpose of these is to get the implant placed accurately and to get the sizing right, and it also decreases the surgery quickly. And so this is where we started on the left, and this is Mark's ankle on the right after the replacement's been in, and this is him standing. And you can see on the left-hand screen how the ankle is no longer crooked. The ankle is in fact straight, and there's very little swelling around the ankle. So Mark, often patients will come in and they'll want to know, what does it look like in surgery? How long is the surgery? Am I staying in the hospital, rehab, things like that? Can you just share your experience, maybe the day of surgery, and then progress through the rehab?
Sure, sure. What I remember is I entered the waiting area at about 12 o'clock in the afternoon, and I was taken into the operating room about 1 o'clock, 1:30. I'm not sure what time I woke up. I woke up, it was all done. I stayed overnight in the hospital. There was, I would say, minimal to moderate surgical pain, really nothing that I expected a lot worse. And I was let go the next day or two. I know I was in a cast. It was a soft cast, and then it was changed to a hard cast 2 weeks later. I wasn't allowed to move around too much. But after day 2 or 3 at home, I had absolutely zero pain. There was nothing at all. The only pain, now I think then I was changed to a hard cast for about 6 to 8 weeks. I don't remember exactly what, before the walking boot. But even in the hard cast, no pain at all. The only discomfort I had was the cast itself, because I'm not used to just being immobilized like that. Other than that feeling of uncomfortable is the surgical pain, the surgery, the post-op, it was really nothing. I was very, very surprised and happy, you know. After that, I was home, and then you put me in a walking boot about 6, 8 weeks later, which was, I was walking around just like fine with the boot. And then we started physical therapy. Unfortunately, I started physical therapy, and then COVID came around, and then things were closed down. But I just want to say Dr. Fleming was fantastic, because he is open to texts, to phone calls, anything you need, and he's there and he answers, and he's wonderful. And he guided me through basically physical therapy at home for a couple of months till they reopened. And then everything just fell into place. As far as pain and walking, the only thing you have to have is a little patience, because it's not, and I think in my case, it was not related to the ankle, because I had zero pain in the ankle prosthesis replacement part from almost day 1. When I started to walk again, my pain was in my foot, on the side of my foot, which Dr. Fleming had showed you was very, very contorted. And he straightened everything out and redid all the ligaments. And, you know, you just work through it. It was fine. And then probably about 9, 10 months, pain was gone. Everything was gone. I mean, I don't want to stress that there was pain, because it really was not. It was a little uncomfortable walking on the foot, not the ankle. But other than that, nothing. And from that day on, I mean, I see Dr. Fleming on post-ops, and I told him straight out, phenomenal. Thank you for my life back. I'm able to, I wasn't able to walk to the mailbox. You saw my ankle on the pictures. I go now walk 2 to 3 miles at a time on the boardwalk. I play sport, but very limited. I am not going to go through, you know, the pain of getting to an ankle surgery again. And so I do play basketball a little bit. I do play a little tennis, whatever, but it's fine. I swim a lot, no pain. And that's my main thing to tell the patients, no pain. My life is back again, thanks to Dr. Fleming. Again, everybody else wanted to fuse it. I refused to accept that, and I'm glad I refused. I knew sooner or later, you know?
Yeah. Well, thanks. You know, it's been a privilege to care for you. It's been a real joy. My satisfaction is high with ankle replacement, and I think your experience, you know, shows that. But you know, thank you for trusting your care to UOA. Thank you for trusting your care to me. And we certainly are wishing these continued conversations as I see you year to year for your follow-up.
Absolutely.
We're wishing your family health and blessings in the next season. And again, we're just grateful for your time.
Appreciate it very much, and the same to you. And you know, you mentioned University Orthopedic. I can't say enough about how well run that practice is. Again, I was in practice for 43 years, and I know what it's like, especially in a large practice like you guys have. And you are so well run and organized and efficient. It's a pleasure to do business with.
Great. Well, thank you so much again for your time, Mark.
My pleasure. Thank you, Dr. Fleming. I will see you soon.